DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here from DocTalk. I'm glad that you joined us today. We have a very special guest, Dr. Bob Larson from the Veterinary School at Kansas State University. We're going to talk about trichomoniasis in cattle, and we're going to talk about a new tool that's available that's developed by Dr. Larson and his colleagues called the Trich Consult on how to control it within your herd. Thanks for watching and stay tuned.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. Bob, welcome to the show.
It's good to be here.
Folks, this is Dr. Bob Larson, and Bob is a professor here. He's the Coleman Chair in Production Medicine at Kansas State University, and is one of those people that when we get him on the show, I always enjoy it because I'm going to learn something, and I'm sure that y'all will as well. And so thanks for being here.
It's good to be here.
All right. Bob, we're going to talk about trich and what it is, why it's important, and thanks for all the work that you're doing on it.
All right. Yeah, trichomoniasis, or it's easier just to say trich,
Yep.
is a very important disease for cattle because it causes probably some of the greatest losses that we will see. In that a herd that has trichomoniasis, you can have up to 50% fewer calves born than you would have. And we don't have very many diseases that has that large of an effect. Now, it's not all that common. The best estimates that are about 7 or 8% of U.S. beef herds have trichomoniasis. But that is just common enough that, you know, in any one area, a number of herds can be affected. And so it is an extremely important disease. It's passed in the act of mating. It's a venereal disease. So an infected cow can pass it to a bull in the act of mating, or an infected bull will pass it to an infected cow, or a non-infected cow, and cause her to become infected, and then she will lose that calf subsequently. Now, the cow and the bull themselves are not sick. It's not a disease that makes the adults sick. It's only going to cause that pregnancy loss in those cows that become infected.
It makes us sick.
Yeah, because I lost half my calves before they even had a chance to be born.
Exactly.
So it is an important disease, and because you can't just look at the cattle and say, well, they're sick, so let's get the doc out and let's do something with them. You really don't know that you're having a problem until, lo and behold, you've got a bunch of open cows at preg check time.
Yeah, so it can be just financially devastating to a herd to come up at preg check time and not have any or 50% of your calf crop not be there. And so when we start to think about trich and that's what's pretty much caused all these regulations and things going across the country.
Yes, there's a lot of interest in, because the cattle aren't sick, I can't see it very easily. We have to find this disease through some diagnostic testing. So you have to take samples from the penis of the bull, send that to a diagnostic lab, and because of that necessity, a lot of states are saying we want to try to keep this out of our states, or if we can't keep it out of the state, at least limit how much of this disease is being moved in the purchase and movement of breeding animals, both cows and bulls.
Yeah, and I think it's smart. I think it's we're sitting here trying to figure out, you know, not only do we have a big investment for ourselves but we don't understand the overall economic value of the beef industry on our state's economies.
Yeah, it's really important in many parts of the country.
Yeah, and so we need these calves to hit the ground, not only so we can keep Main Street open in rural communities, but also in some of our urban and suburban communities as well. We're going to take a break, Bob. When we come back, we're going to talk about a tool that Dr. Larson and his colleagues here at Kansas State have developed called the Trick Consult. Stay tuned and enjoy the show.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Lee Michaels is a student at the University of Minnesota College of Veterinary Medicine. He recently received the Merck Animal Health Student Recognition Award. Raised on a dairy in Wisconsin, Lee developed a passion for dairy production, and at school he spent much of his time working with the Production Animal Medicine Club. Upon graduation, he hopes to practice in a rural Midwest community.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to Doc Talk. It's Dan Thompson with Dr. Bob Larson. And we're here at the College of Veterinary Medicine at Kansas State University, where Dr. Larson is a professor, and he's boarded in numerous areas associated with beef cattle production, health, and well-being. And he and his colleagues have developed a new tool called the Trick Consult. That's an online tool, right?
That's right. It's one of the things we wanted to develop was a tool that producers and veterinarians from anywhere could have access to and easy access to. And so it is online, trickconsult.org, and you can find the Trick Consult tool.
And it's trick with a CH on the end, not a CK.
That's right, T-R-I-C-H.
You go to the other one, you might not get the same results.
I don't take any responsibility for what you might find on the internet.
All right, well, let's talk a little bit about this and talk about how it's set up. I mean, you've developed it to help provide 24-hour access.
Yes. Well, the reason that we started this conversation, and there was a number of us, there were several of us from Kansas State University, as well as a couple from the University of Nebraska, some experts from the University of Florida, even from Canada, that all got together to come up with a way, because this is a disease that has tremendous impact. And we know quite a bit about it and quite a bit about how to control it. But honestly, the best control is different for different herds. And so it's difficult to, in a relatively short period of time, train a producer and veterinarian what's the best way to control it for their herd. For, you know, it's the size of the herd, the number of bulls they have, how often they buy bulls, what their neighbors are doing. All of those kinds of situations or questions impact the best control program for a specific herd. And so, like many complex production or health questions, we know the answers. It's hard to teach it in a compact enough time frame that it's really valuable to people. And so what we wanted to do was kind of to mimic a phone call with an expert about trichomoniasis or trick. And so it's a series of questions that the producer and veterinarian can sit down and ask together online. And the very first question is, do you have trick in your herd? In other words, are you asking this question because, gosh, we found it, now we need to know what to do?
Yeah.
Or, no, I just listened to DocTalk and now I want to find out more about it. And so then you would answer no. And that's really important because a herd that is currently dealing with the disease is very different than a herd that isn't. And so the herd that is dealing with it, we're going to immediately start talking about what are the testing and removal strategies we're going to do to eliminate this disease from their herd.
Yeah, and so when we start out, and we got about 30 seconds till we got to go to a break, but once you say yes or no, then the thing starts tumbling.
That's right. There's about 6 to 10 questions, and the questions you will get and the answers that you receive depend on the previous questions that you've had. In other words, the second question might be, you know, what are you going to do on biosecurity for bulls? But the way that's asked and the answers you're going to get are going to depend on whether you answered yes, I have trick, or no, I don't. And so there's 6 to 10 questions that the producer and veterinarian answer together, and the questions are phrased in a way, basically, are you able to implement some strategy? And it's yes or no, and you go from there.
Cool. After the break, more with Dr. Bob Larson.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to Doc Talk. I'm here with my friend and colleague, Dr. Bob Larson, and it's always a joy to have Dr. Larson on the show and get to talk about some things with cow-calf and feedlot and that. You know, I've been in the feedlot industry, but my heart has always been on the cow-calf.
Cows and calves are fun.
My dad
and bulls.
Yeah, my dad and I, family having cows, and so it's always good to spend time with you, Bob, and appreciate all you do for our industry. When we talked about the Trick Consult, and again, it's Trick Consult on the Google, or if you're looking for this tool, Bob, you say that besides these 6 to 10 questions that you have after the yes, no, do you have trick in your herd, yes or no? These 6 to 10 questions, there's further information within this program.
That's right. We tried to make the questions pretty straightforward and direct. You know, will you be able to segregate cows, or just direct questions. But a lot of times you need more information to know exactly how to answer that question, whether to answer it yes or no, or what do you mean by certain things. And so on each step of the Trick Consult, there's a little blue icon that you can click to get more information. And that more information is basically a relatively short summary of the research information that's available on that particular subject. We did a really thorough literature review of all the research that's been done on trichomoniasis, so that we've got the most up-to-date information that's available on everything from how we use testing, how we use segregation, the best economic outcomes. All of those have been researched, and we summarize those into those more information tabs. The nice thing about that is, there's a lot to learn. There's experts that spend their whole career looking at trichomoniasis, but a producer and veterinarian trying to establish a program for themselves, they're not going to take the time to learn 30 years worth of information. But with those more information buttons that you can push, you can learn just the things that you really need to know to answer the question, what kind of a control program do I need for my ranch? And so it allows you to learn as much as you need to learn, but not a lot extra.
Yeah, and I think that it's just so important as a practitioner. Our job is to gather the information, get it to our producers, sit down in an advisement capacity, and work forward. And leaning on people like you and myself out of the land grant institution, it is our job and our duty, not only to the state but the country, to distill this information, get it to a usable form. You've been in practice, I've been in practice. We have a good understanding of what people on the front line are dealing with,
right.
And that's what you've done, is put this in a sense that, hey, do you want to know more about trick? Do you want to know more about the positives and negatives of trick in your herd? And then here's the things you can do to make sure you don't have it.
Right. We think it's a pretty user-friendly tool. Again, the questions are pretty specific, and the questions basically are directed at the rancher. Will you be able to implement this in your herd? And whether they say yes or no, the tool continues on down, and then at the end it kind of gives them a printed out report that says, well, these are the things that are going to work really well. You're still going to have some risk in this area, so you're going to want to watch it more closely. And that's very customized for each ranch, because we know each ranch is different, the things that they're able to implement and they're not, and it allows a well-informed decision.
Cool. Trick Consult, folks, something that you better get on the radar. We're going to come back with a wrap-up here with Dr. Larson after the break.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Howdy, this is Kurt Pate with your Beef Quality Assurance Tip of the Day. To me, we need to look at our stockmanship, our cattle production, all of our practices that we do from the finished product back. So what I'd like to do is figure out what in my operation I need to have when they leave my place. That's the end product. Now all the best practices that I can do following beef quality assurance guidelines, to me, I'm going to follow them backwards. We are not only responsible for ourselves, but getting the animals ready for the next part of the chain. So if I'm taking that calf, what is that going to do to get that calf where he's better to work when I'm vaccinating him in a chute? Every interaction we have with an animal creates either a better result or a worse result on handling the animal in the next step of the chain. So always be aware of that. Your animals are either going to get it better or worse by the way we interact and handle them.
it must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously, but it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multacida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. I'm here with my friend and colleague from the College of Veterinary Medicine at Kansas State University, Dr. Bob Larson, who is a professor, and he's the Coleman Chair here at Kansas State University in production medicine, and teaches epidemiology, teaches nutrition, theorio, all different types of subjects to our veterinary students and graduate students, and aside from that has this role in extension and outreach that he and his colleagues have developed, the Trick Consult, which, Bob, we've gone through what a trick is, how the program works, how it's directed towards the veterinarians and the producer. Now let's get to that result. What do I have when I get done going through this? What am I going to have to step outside and start fighting trick?
Exactly. So the veterinarian and producer have walked through 6 to 10 questions that pretty much describes their current situation and what they're able to do to control trichomoniasis. And then you end up with basically a 3 to 4 page report that's how you answered each one of those questions, and then a summary at the end. And those are going to be different depending on how you answered the questions. And so each ranch gets basically the program that's going to work best for them. And so the report then can be emailed to yourself. You can print it off. I'm not as technologically savvy as the people that help us, but basically you can collect it in any format, save it for future use, print it off, put it on your smartphone, and you'll have the report right there for use. And again, what I think is the beauty versus just, so much of our education oftentimes is kind of the best practices. This is what you should do, but there's enough differences from ranch to ranch that, if I was interacting with someone directly, we would make a more specific program just for them. Exactly. And that's what this tool allows you to do.
It never amazes me that, it seems as though people that are further away from production or further away from the trenches want to write these best management practices thinking that one size fits all. Heck, one size doesn't fit all on how I'm just going to get to work this morning,
That's right.
And so when you start to think about the expertise and the facilities and the size of the herd and the remoteness and all the different things that we go into, geographical region,
yes,
buying practices, all these things go into your consult or goes into us working one-on-one.
So what we think we've developed is something that is very complex on the backside. In other words, it's done a complete literature review, tried to learn as much as we can about trick and think about how it would work in so many different situations. So it's complex on the backside, but on the front side, what the producer and the veterinarian see is a pretty simple 6 to 10 questions, 3 to 4 page report that summarizes everything you need.
Well, Thanks for the tool. Thanks for what you do.
You bet. Good to be here, Dan.
Thanks for being here on the show. Folks, if you want to know more about what Dr. Larson and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local veterinarian. Use Trick Consult, pull it up, pull your veterinarian in, and take a look. Thanks for watching Doc Talk. I'm Dr. Dan Thompson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.